Robert, the big splash you've made at CES is actually a new product area. You're moving into bio-wearables. Why now?
Well, I think it's a strategy that we've been developing for a while. We started this bio-wearable with diabetes with our Freestyle Libre system, and now we're the leader in continuous glucose monitoring in diabetes. So we took this platform and started to look at other analytes and other systems that we could look at and measure. So we are announcing here our intention of this family of products called Lingo, which can allow us to monitor not just glucose but ketone, lactate, and even alcohol.
Is this you taking on Apple and the Apple Watch?
No, this is Abbott understanding that there's a convergence. There's a convergence of health and of tech. And we've seen this convergence happening several years ago. It's obviously been accelerated during the pandemic, but this is definitely something that we believe that we have a role to play in and where the future of healthcare is going. So this is really more about Abbott leading in this convergence of tech and health, and showing all the capabilities that we've had as a healthcare company for the last 130 years.
So talk to me about the consumer then. How has the consumer's attitude towards healthcare changed over the pandemic? Do you expect spending on devices, data, monitoring to now increase through 2022?
Yeah, we do. I mean, I think we've seen, even before the pandemic, and like I said, it's been accelerated, even before the pandemic, this desire to have more control, more information, and in a way that's easily accessible so that consumers can take a little bit more control of their health and actually share a common language with their physicians so they can make all the best decisions. So we think this is a growth area, and Abbott's going to be a leader in this space.
You're at CES in person, one of the few executives to kind of stay with a plan to attend. And COVID's top of mind, right? We had this Christmas or holiday period where tests were very hard to come by. Why is that? Why has it been so hard to get an at-home or rapid test?
Well, I think we've seen a convergence here actually of two things. We've seen obviously a new variant, a pretty highly transmissible variant, in combination with a period of the year where there's a lot of travel. Thanksgiving and Christmas, people wanted to get together. So the combination of those two factors really had a pretty unprecedented demand here. But since the beginning of the pandemic, Abbott's really been the forefront and leading the way here. We began manufacturing Binax here in the US with our 3 manufacturing sites back in September of 2020. We got to about 50 million tests. We saw cases go down in the beginning of 2021. So we had to ramp down our manufacturing. But as Delta resurged here in the US, we've quickly re-engaged our manufacturing. We're back to 50 million. This month we'll do 70 million. And I'm working with my team every day to see if we can get us to 100 million.
And just to be sure, these tests can detect the Omicron variant.
Well, listen, this is definitely something. So the answer is yes. We've been working closely with not only our own scientists, but with scientists around the world. We have a network of scientists, and we keep on studying not only the Omicron variant, but even new mutations that surge to make sure that the sensitivity that we have with our test is still a sensitivity that consumers can trust and rely upon. And right now, what we've seen with Omicron, with our own internal testing, is that we have the same sensitivity that we had back with the Beta variant and even with the Delta variant.
Final one on testing. How much of a challenge are supply chains for the different parts of a COVID test right now? Are you sort of engaging with the White House directly over that? And what is the outlook for this year?
Well, listen, we've engaged with not only the White House, we engage with governors and states and a variety of different stakeholders. Supply chain is tough. It's tough for a lot of companies across all different sectors, right? But we've made sure to manufacture our tests here in the US. So we built 3 factories here in the US just to do COVID tests so that we had a little bit more control of our supply chain. And yeah, we're working with the White House. We're working with different governors to make sure that every single test that we make, that it does not sit in our inventory and we get it out to the people so they could use it.
Let's bring this full circle then to CES and the consumer. How do you read the consumer's use of testing and data going into 2022? Has it given you any ideas about healthcare big picture going forward?
Yeah, I think that the notion of you being able to do a diagnostic test and not necessarily have to go to a hospital or go to a lab, I think this is a new consumer behavior that will emerge from the pandemic. And Abbott believes that this is a behavior that will be here to stay. And so we're developing a whole new diagnostic testing channel with all of our partners to be able to create an opportunity for people to be able to test not only at hospitals or doctors' offices, but even at pharmacy and at their homes. So I think this is a trend that's going to stay.